So these clinical practice gaps were founded in two different publications that came out in 2022 and 2024. And these practice gaps are designed to discuss where we have patients that are failing to have biomarker testing results that can lead to targeted therapy approaches. Now, these gaps were identified specifically in advanced metastatic non-small cell lung cancer patients because these patients have at least 10 genomic biomarkers where alterations can be identified where they can receive targeted therapies. Now, these practice gaps range anywhere from being pathology focused, so this includes tissue insufficiency or not having the appropriate tumor cell content for testing, not choosing the correct testing method for these particular patients, and also on the medical oncology side, where these patients, even though they are biomarker positive, don't necessarily receive the matched targeted therapy that can really give them better outcomes. What we really want to see is that the best testing approach is used for these patients, where they can use a comprehensive genomic profiling test, where they can identify the alterations in a large set of genes. All those alterations can be tested along with genomic signatures in a single test. That way, if we have limited tissue, we can then get a result for these patients, and we can properly identify the alteration that we can use for a match-targeted therapy.